To do Pharmacare or not to, that's the question dominating debate on Parliament Hill today. That agreement between the Liberals and NDP, the one that keeps the Liberals in power, stipulates the government has to pass legislation to set up a framework for universal Pharmacare by the end of this year. The problem, there's just over 2 weeks left of this sitting, and that legislation has yet to even be introduced. The NDP seems to be, as you heard there, okay with extending the timeline, but wants to see more results in the interim, although it's unclear what exactly that means specifically. Does the politics of this mean the prospect of Pharmacare is diminished? And what are the consequences of that? Dr. Eric Hoskins chaired the advisory council back in 2019 that recommended the feds pursue universal single-payer Pharmacare and laid out the path to get there. Dr. Hoskins is also a former Liberal health minister in Ontario. Hi, Doctor. Good to see you. Thank you so much for making the time.
Hi, great to see you again.
You wrote an op-ed in the Globe and Mail back in October that kind of posed the question off the top. Will 2023 be the year Canadians finally get Pharmacare? Is your sense now that it likely won't be?
Well, look, first of all, those comments that you ran just a moment ago from the Prime Minister and from the NDP sounded quite optimistic to me. I think it's absolutely the right decision not to get bound by a timeline, particularly when it was a deadline that was agreed to by those two parties themselves. I'm still very hopeful that we can introduce the government can introduce legislation before the December break. But even if it needs to get pushed into next year, look, this is an effort getting Pharmacare added to Medicare that's been going on for some 55 years. I think if we spend a bit more time to ensure that we get the legislation right and make some demonstrable progress, some really important progress that is meaningful to Canadians and Canadians in terms of their pocketbooks and their ability to access medicines, I think that's a great victory.
When the legislation is introduced, if it is, it does sound from those comments like it will be eventually, what are kind of the key indicators, or what is a key indicator for you against which you will judge its success or its potential effectiveness?
Well, I think there's two pieces to it. One is the model of Pharmacare. So the report from the council that I chaired, we issued our report in 2019, and we were very clear in advocating for what's known as a single-payer public Pharmacare program, universal to all Canadians. So that would be where the federal government, together with the provinces and territories, would come in and provide access to prescribed medicines for all Canadians, and the federal government would pay the incremental costs to do that. So that's the type of Pharmacare that we advocated for. And frankly, I think 7 or 8 committees or councils, parliamentary budget officers before and after me all recommended the same thing. So I think that the model that's chosen is important. And then the second piece is simply, what's the first step? We advocated for tackling essential meds first, about 50% of all prescriptions written. We could do that for $3.5 billion. That's less than That's about 1/2 of 1% of the federal budget to be able to implement what would be extremely meaningful to so many Canadians that, frankly, estimated 1 in 5 Canadians that can't access medicines today.
Dr. Hoskins, you mentioned one of the associated costs to kind of a phased-in approach. The parliamentary budget officer, and you'll be familiar with these numbers because they're cited frequently with people who have some hesitancy around introducing a program of this scale, estimated that at its fullest cost, it could cost up to $13.4 billion in 2027. Now, that's not to say there aren't also economic costs realized for Canadians in the long term, particularly cost savings on drug expenditures, which the PBO said would reach $2.2 billion by 2027. But how do you counter, I guess, those concerns that many people in the federal government right now, whom I speak with, certainly have, given, for example, the fiscal environment that we're in right now, and even the fiscal anchors that they detailed for the first time in the recent fall economic statement?
Well, when I was Ontario Health Minister, we faced a similar dilemma. Right? We wanted to introduce single-payer public Pharmacare. We made that decision. We chose the model, but we chose to start it with all Ontarians under the age of 25 to provide them with free prescription medications, and we did that. And so what we did is we committed to the model, but then we took a first step that we felt we could afford at that point in time. And in fact, we were judged by the credit rating agencies based on the step that we had taken, not the possibility that we would eventually implement full Pharmacare for all Ontarians. And so it's a very similar situation here. First of all, as I mentioned, essential meds is about 1/2 of 1% of the federal budget. So it's significant, but it's certainly not overwhelming. And it's less than what the cost of the similar programs, if you look at dental care, you look at child care as well, which were incredible national projects. So, but you highlighted, which is equally important, we need to look at the benefits. The benefits of Pharmacare are not just the cost savings by bulk purchasing, but we estimate with full Pharmacare that the average family will save $350 a year, employers $750 per employee, that will save billions of dollars because we're keeping people out of hospitals and out of ERs because they're healthier. So it's particularly at this time where people are struggling to put food on the table, quite frankly. And we found that in Pharmacare as well, that people were having to make those difficult choices between food and heating and the medicines for their children, for example. This is a great pocketbook issue for Canadians that's so tangible and meaningful right now. The stars are truly aligned to make this happen.
It's interesting that you frame it that way, and I'll conclude on this question, because so much of the political discourse, and actually what people certainly approach me, and I'm sure you and many other people with questions about and concerns about, is the cost of living right now, the rate of inflation, the interest rates. They aren't ranking, let's say, healthcare at the top of the list where they might have 3 or 4 years ago. How do you, I guess, respond to what might result in a lack of political will just because this issue in particular is not at the top of the list at this very moment?
I know the principals involved in the negotiations. They're great, committed individuals working extremely hard right now to reach an agreement. The fact that it was in the supply agreement to begin with shows that both parties, the Liberals and NDP, are committed to it. This may be a moment in time like another, that like no other, that I mentioned earlier about the stars being aligned. I think we really do have this once in a generation opportunity to introduce Pharmacare. It will be incredibly meaningful to all Canadians, Canadians that value and cherish our healthcare system, our universal healthcare system, but certainly the 1 in 5 families that can't afford the medicine, the people that that have to make those difficult choices about putting food on the table or heating their homes or providing medicines for a family member. So it's not only a pocketbook issue, this is great policy. I'm confident that the folks that are involved in these negotiations know that and want to make this happen. So pushing it a little bit further into 2024, I think it's an absolute necessity to make sure that we accomplish what we really set out to do when we were creating Medicare in the 1960s, to have Pharmacare as part of that.
Okay, Dr. Hoskins, I'll leave it there. Appreciate your time this evening. Thank you so much.
You're welcome.